Michael Lepore talking to you from Sarasota Vascular Specialists about the difference between open surgical techniques for the treatment of abdominal aortic aneurysms and endovascular or percutaneous minimally invasive techniques in treatment of abdominal aortic aneurysms. This technology of endovascular treatment of abdominal aortic aneurysms was really developed in the 1990s. I was fortunate to be at the Ochsner Clinic in New Orleans when we were one of the main study centers for people that came from all over the world to be trained and learn how to do these techniques. It really has revolutionized the treatment of aneurysmal disease because open aneurysm surgery has some very dangerous potential complications. It requires an incision on the abdomen, basically from just below the breastbone down to the pubic bone, opening the abdomen to then get control of the aorta, clamp above and below the aneurysm, and sew a graft in. Patients typically will be in the hospital 5 to 7 days. Probably takes about 6 weeks to get over knowing that you had the operation, and true recovery, feeling back to normal, is probably about 3 months. Endovascular techniques are done now percutaneously, meaning through puncture sites in the groin areas where we place the devices up into the aneurysm itself, and the device is opened at the top where the aorta is normal, just below the kidney arteries, and then in the iliac arteries where it's normal again, and the aneurysm in between basically kind of collapses down around as it thromboses, and the graft stays open. The big difference is patients walk out with Band-Aids in their groins, maybe a little bruising at most, and are home about 99% of the time by lunch the next day. So it has changed drastically, and we now can treat probably about 85 to 90% of all aneurysms with these techniques when it comes to the abdominal aorta. Michael Lepore again talking to you about the difference between endovascular therapy for aortic aneurysms versus open repair.
Thank you.